Welcome to the listeners. I'm excited to introduce our speaker today, Derma Rivera, MPA, with the Iowa Department of Health and Human Services to talk about intimate partner violence. Derma has more than 26 years of experience working in violence prevention. She has, as I said, a master's degree in public administration and is dedicated to supporting and partnering with diverse communities across Iowa. She works as a violence prevention program coordinator at the Iowa Department of Health and Human Services. She manages the Iowa Violent Death Reporting System, which collects information about violent deaths in the state, and this data helps communities and researchers understand what leads to violence and how to prevent it. Derma also leads the Domestic Abuse Death Review Subcommittee, and that subcommittee reviews cases specifically about domestic abuse-related homicides and suicides and offers recommendations to help prevent future fatalities. Derma also provides training and support to agencies that want to improve how they respond to intimate partner violence. She cares deeply about building safer communities and believes that strong information and strong partnerships can save lives. And I cannot agree more. But that is all that I have to share. I'm going to hand it over to our subject matter expert and have Derma walk us through some best practices for IPV.
Hello, everyone. Can you guys hear me? Perfect. I will touch a little bit on cues and a brochure that is used when you are using cues. And this will it's going to be very briefly. If any of you are interested in and receive more depth training on this, I would be happy to schedule that, or you guys can reach out to me and we can work on that. But today, I think cues is this is evidence-based information that is being used or created by Future Without Violence. And I don't know if you can make it a little bit bigger for me. Yeah, perfect. So when we talk about cues, as I mentioned, it's an evidence-based intervention to address domestic and sexual violence in healthcare systems. So I think this has been very, very helpful for people who, like you guys, doctors and nurses. They have patients coming to your clinics, and sometimes they disclose that they are victims of domestic violence. Sometimes you see the signs of domestic violence on their behavior or on their physical. So cues is confidentiality, universal education, and is empowerment and support. And this, once you have been trained, and it takes up to 30 seconds to provide this universal education and resources to your patients. And the way they do it is, you can show the brochure that we use in combination with cues. Christina, please.
Go back up. I apologize.
The other one. So I think this is another. Yeah, perfect. So you can get access to this small brochure that can fit in your pocket. Easy to access for people, for victims of domestic violence that don't want anyone at home to know that they have received any information. So it's easy for them to access and to keep this safe without people noticing that they have some information on how to protect themselves. This brochure, what we advise our healthcare providers is to, for example, to say, hey, we are giving these brochures to everyone. We usually give to our all our patients. This small brochure talks about healthy relationships, and when things are stressful, sometimes relationships can be stressful and can cause issues physically and mentally. So we just want you to have this information. So we ask providers to give to their patients, and you can say, we are giving them two in case maybe a friend of yours need it, and you can pass that along. So it's a way to normalize. You're passing that information to everyone without feeling like you're singling them out. Like, why you notice? Do you think I'm a victim? Even though sometimes they are they might be a victim. We don't want to make them feel like they need to disclose or feel like single out, right? So normalizing is a good way to say we're giving this to everyone. You might not need it, you might need it, and it's just talk about relationships, not nothing that can direct them to talk about DV, even though that is the goal, right? In the back of the brochure, it has some resources too that you can that they can access, and everything that we do, and that's the first letter that you talk about is confidential. When you start working with your patient, you talk about everything we're talking about is confidential. And of course, as a provider, there is certain things that sometimes you gotta be able to say, like in case you are disclosing suicidal thoughts or things like that, that is gonna change about confidentiality. But it's making them feel comfortable. And cues and this brochure is not about disclosing, but it's just about passing information, empowering them to say, this is information for you. When you are ready, you can talk to us. It stays disclosed. So then hopefully you have a place or a process in place that you can see how you can work with your patients. A lot of clinics has a intake. They already talk about domestic violence and feeling safe at home, and these cues is just an extra support for you. But then also, if you wanna create a coordinate with organizations in your neighborhood or in your area where you have an advocate that works in domestic violence and sexual violence, that would be helpful to create that partnership with others. And you can be ready in case a patient discloses and wants to talk to someone. So I think on that is briefly, if you guys, any of you are more interested on receiving more information or training on this, I would be more than happy to provide the training. It takes a little bit longer than a few minutes that I'm taking right now because we want to review the cases, right? So, but I'm available, so let us know. You can put in the chat if you guys want more information.
Derma, did you want to briefly go through the culturally specific programs that are offered throughout Iowa?
Yep. So the cases, some of the cases we are reviewing is from different cultures. So um, the Iowa Coalition Against Domestic Violence created this. This specific one was from the Attorney General's office, but a lot of the information came from the Coalition Against Domestic Violence. And you can see they have the Amani community, they have the people with disabilities, they have, I think, people who work with monsoon, who work with Pacific and Islander, and they have Embark. They work with a lot of people from the continent of Africa, different places on the countries in Africa, and you have Iowa Safe, who work with the LGBT community. So, but if any of you need more resources, if you find someone in your clinic that need more resources that you don't see here, you can always reach out to us too.
Fantastic. Does anyone have any questions relating to